Hi, I'm Cindy, nurse practitioner here at Restore Wellness and Aesthetics. I wanted to come on and give an update on a recent FDA announcement regarding the testosterone therapy. So for years, the FDA has issued a black box warning against testosterone therapy in patients regarding increased cardiovascular risk of heart attack, stroke, and even death. So the FDA recently announced a removal of that black box warning against testosterone therapy, which is very good news and positive news and affirmative for patients who need testosterone therapy because of their condition. And so recently, what has been published in the literature in 2023, the Traverse trial published a study of 5,200 men who were at high risk of cardiovascular disease and also had hypogonadism, which is hypogonadism is just low testosterone levels. And so what they found was that the men who were given testosterone therapy compared to the men given placebo therapy, that there was no increased risk of cardiovascular event, of stroke, heart attack, or death. Which is very positive and affirmative again towards using testosterone therapy. The study did show, and the FDA does warn about a mild increase in blood pressure, and so the systolic blood pressure was found to be on average higher about 4 points, and the diastolic pressure about 1.5 points. So there is this caution there, of course, to monitor patients for hypertension in regards to their blood pressure. But overall, very good news regarding testosterone therapy for patients. Another study that was published in 2024 was by Dr. Thomas Blackwell. He is a physician out of University of Texas. So he and his team analyzed over 133,000 cases or charts of patients who received testosterone therapy. So just a huge, massive amount of patients that they are studied. And so at the end of their study, they published, again, agreeing with the Traverse findings, that there was a decreased risk of cardiovascular events, of stroke and heart attack. They also found lower incidence of AFib and arrhythmia. And interestingly enough, they found lower incidence of prostate cancer, which is a huge finding in this study. And so that certainly opens up the door for the need of more clinical trials, more clinical studies in that area. But for now, we have the decreased risk of cardiovascular disease, or at least the safety or the removal of the black box warning of the risk of increased heart attack or stroke from the FDA, which is good news and positive for anybody considering or needing testosterone replacement therapy. So here at Restore, we do specialize in using bioidentical hormones for replacement therapy. And so bioidentical hormones are considered the safest and most natural form of hormone replacement that we can use for our patients. So low testosterone is associated with many disease processes, worsening metabolic diseases such as diabetes or obesity, fatigue, muscle loss, decreased bone mass, decreased mental capacity, depression, just all sorts of things that low testosterone can be associated with. So there are many benefits to having, that we know already, to having testosterone replacement therapy. And so if you're interested or needing this, if you're needing a consult, just click on the button below and we'll be happy to consult with you. Also, if you like this video, hit like and subscribe to our channel and leave a comment or question, and we'll be happy to make it our next video. But you guys have a great day.